Tonight, a community is mourning the suicide of a 13-year-old who took his life at school.
This is Suicide Prevention Month, designed to raise awareness of an epidemic. Every 90 minutes, someone between the ages of 15 and 24 takes his or her life. The young woman you're about to meet tonight was 17.
Only 13% of people reported that they live with high levels of good mental health in a survey that was recently commissioned by the Mental Health Foundation. The sad truth is that poor mental health is rife in the UK at the moment, and even though stress, anxiety and depression are particularly common, with 1 in 6 workers experiencing one at any one time,
Assalamualaikum and a very good day to ladies and gentlemen. Welcome to our virtual discussion of today. My name is Faiz Randani binti Mak Faizul, your moderator for today's discussion. First of all, I would like to thank you guys for listening to our discussion. Our discussion topic for today is mental health is a health issue. Ladies and gentlemen, before we start, I would like to introduce our panel members for today. All of them have a lot of knowledge and also experiences about this topic that will be discussed. Our first panel member is Mr. Hakim, a student from UiTM Alun Gajah Melaka who has been diagnosed with mental illness. How are you, Mr. Hakim?
I'm fine. Thank you, Ms. Daini.
Next, I introduce the second panel member, Ms. Shahira, a counselor from UiTM Alun Gajah. How are you, Miss?
I'm good, thank you.
Moving on to the third panel which is Dr. Aino, one of the famous psychologists. How are you, Dr. Aino?
Thank you, moderator. I'm good.
And our last panel is Dr. Farah, a very experienced doctor. How are you doing, doctor?
I'm good and glad to be here for this discussion.
Glad to hear that. Alright, ladies and gentlemen, before we start the discussion, do you guys know what is the meaning of mental health? So, mental health is an illness and it refers to a wide range of mental health conditions that affect your mood, thinking, and behavior. Examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behaviors. Many people have mental health concerns from time to time, but a mental health concern becomes a mental illness when ongoing signs and symptoms can cause frequent stress and affect your ability to function. A mental illness can make you miserable and can cause problems in your daily life, such as at school, or work, or even in relationships. In most cases, symptoms can be managed with a combination of medications and talk therapy. Alright everyone, without further ado, let's start our discussion with our first panel, Mr. Hakim. Mr. Hakim, do you mind sharing your experience? Like, how do you feel when you were diagnosed with mental illness?
Okay. Hi everyone. I'm glad that I'm invited here today to share my experience as a student when I was confirmed diagnosed with mental illness, which is depression by my psychiatrist. And I hope that my story can open up people's eyes that mental illness is not something that we can be taken lightly. So in my experience, at first, it was just like an ordinary day where you just get on with your life like a normal person, but feel a little stressed out with assignments and university work like any other students. We started out small. As days went by, I started out to feel more anxious and depressed as assignments were piling up and I feel like I can't finish them all in time. Panic attacks will just randomly happen and it makes it hard for me to keep focusing on my studies. I keep spacing out during classes and at night, although I'm drained from all the depression, I still can't get any sleep. I even force myself to take sleeping pills just to get some sleep. It stresses me out even more. And obviously, I tried seeking help from everyone that is close to me, including my parents. However, my parents at first would just tell me to get some rest. They do not understand the pain that I'm going through. I wanted the people that I care for and confided in to open their hearts and minds to understand that depression isn't a choice. I didn't want to be depressed. It is not my decision. When I sought therapy from my parents, they made me feel like my condition wasn't serious enough to seek professional help, and I needed their help more than anything. And then one day, I suddenly collapsed to the ground, and my parents quickly brought me to the hospital. That is when I was confirmed that I was diagnosed with depression. Fortunately, I was able to get medical treatment quickly. Otherwise, I might end up trying to take the easy way out. It is easy for someone who has no personal experience to assume that mental illness is just a mindset. They are definitely wrong. It is more serious and dangerous if they don't seek out those who need help. It can happen to anyone, including those that are close to you. No one is immune to mental health issues like anxiety and depression, and what triggers me and what triggers others may not be the same. So I hope we can all help each other out and not belittle one's struggle. And lastly, as a Muslim, we must also not to forget to seek help from Allah Subhanahu Wa Taala, and that's what I did. And because there is no illness that can't be cured with the help of Allah Subhanahu Wa Taala. And that is all for me. Thank you again for giving me the opportunity to share my story. Thank you.
Thank you, Mr. Hakim. What an eye-opening experience. So I agree what Mr. Hakim said just now. He did mention that not everyone will understand their situation and act as if mental health is a small matter. Alright, let's discuss more about our topic today. I would like to hear from Ms. Shahira's opinion. Miss, can you tell us how many types of mental health disorder that we have?
Thank you, Ms. Daini. Hello and hi everyone. Thank you for the chances given to me to speak up about this issue today and open the eyes of many people about mental health. I am a counselor from UiTM Alor Gajah and have dealt with many students' mental situations such as depression, anxiety, panic attack, major stress, and etc. This kind of illness could lead to many more complications, not only to the mental but also to the physical health. As a counselor, I could only provide short-term solutions in which I look at their problems in an objective way. I show different dimensions to understand the situation. I help them to know their strengths and weaknesses without being judgmental. I am involved in an exploration of the problems in an environment that is both supportive and objective, and also involved in the identification of alternative courses of action that might solve a problem. I suggest strategies for managing and altering pattern of upsetting thoughts, feelings, and behavior of the students. Mental health issues can have a deep impact on how we think, feel, and behave. They can range from our daily worries we have from time to time to serious problems. According to the Mental Health Foundation, MHF, there are two main types of mental health problems, which is the first is the neurotic symptoms and the second is the psychotic symptoms. Individuals that have common mental health issues are very likely to have neurotic symptoms. These are harsh versions of normal emotions such as sadness, and anxiety. It includes depression, anxiety, OCD, which is obsessive compulsive disorder, PTSD, post-traumatic stress disorder, panic disorders. Psychotic symptoms interfere with a person's perceptions of reality, which may include hallucination of the things such as seeing, smelling, hearing, or feeling things that no one else can. It includes schizophrenia, eating disorders, bipolar, and personality disorder. The common counseling concerns that I have dealt with the students' mental issues were anxiety, depression, sadness and loneliness, feeling hopeless, suicidal thoughts, relationship, and family issues, and feelings of anger. All of them are trying to cope with themselves because some of their parents would think that it is just a normal stress that comes once in a while. They did not know how their children were cooperating with themselves just to be better. The students would think that they are a burden to their family, which affects their mental health. Because of society's perception, where mental issues are not something serious, they are afraid to step up and seek help. They think they should just stay, and time by time things will be cured just like that. Finally, they come up to their school's counselor to share their problems and get validated. That is all they want because it matters. They are struggling the same as the patient with physical problem. As our first panel, Mr. Hakim said at first, it started out small, but eventually he couldn't take it any longer. It is because he thought it was a small matter when it's actually affecting his health day by day. Until one day, he passed out and was taken to the hospital. That is when his parents open their eyes and realize how heavy this issue is. And about our discussion today is whether mental health is a health issue. Yes, it is a health issue and should be taken seriously. If any of the students need ears to listen to their problems, just go to the council of your school. We will listen to your problems with an open heart. Just please seek help before your problems become worse.
Thank you, Mr. Shaira, for the explanation. I hope that everyone is clear about the types of mental health. And if, let's say, you guys have one of those symptoms that have been listed by Mr. Shaira just now, please take it seriously. Alright, moving on to the third panel, Dr. Aino. Dr. Aino, can you please tell us about mental health from the point of view as a psychologist?
Thank you, Ms. Taini. Hello everyone, nice to meet you. Thank you for inviting me today to give my point of view as a psychologist about mental health. Let me talk about my work first. As a psychologist, I assess, diagnose, and treat the psychological problems and the behavioral dysfunctions resulting from or related to physical and mental health. In addition, we play a major role in the promotion of healthy behavior, preventing diseases, and improving patients' quality of life. The common questions that people always ask me are, the first one is mental health related to psychology, and the second one is mental health a health issue? My answer for both questions will be yes. It is worth noticing here that in the recent past, dealing with health and illness was based on the biomedical paradigm, in which the biological aspects were the main focus of the scientists and practitioners. At present, the understanding of the body-mind behavior relationship has dramatically changed the medical system and practice. This change from the biomedical paradigm to biopsychosocial medicine characterized the current holistic model of health provision. Overall, the biopsychosocial model reflects the belief that biological, psychological, and social factors interact in an interdependent or systematic way to maintain health or cause illness. It is because behavior plays a vital role in mental and physical health. Behavioral health is becoming the cornerstone of biopsychosocial practice. Cassidy described the way behavior may positively or negatively affect the body by stating that lifestyles, life events, and bad behavior are directly related to health and illness. Like the way we think about events determines our response to them in developing healthy or unhealthy behaviors and changes in behaviors. Attitudes to health determine whether we hear or listen to advice from health professionals, and a person's personality may predispose the body to certain dysfunctions. Psychology, as the science of behavior and mental processes, emphasizes training and knowledge about such aspects, which are development over the lifespan, learning, motivations, experience, emotions, cognition, social behavior and attitudes, personality, and etc. Moreover, it strives to understand how biological, behavioral, and social factors influence health and illness. Thus, psychologists, as behavioral health providers, play a major role in understanding how biological, behavioral, and social factors influence health and illness. We are equipped with trainings, skills, and knowledge to understand how basic behavioral and cognitive processes prepare the body to develop these functions. We are trained to perceive how these behavioral and cognitive functions are altered, the factors that contribute to their alteration, and how these dysfunctions are diagnosed and treated. In dealing with such problems, we are also trained and skilled to use several psychological, psychodiagnostic, and psychotherapeutic techniques which help and affect the abilities of individuals to function in diverse settings and roles. In addition, we help people to modify their behavior and lifestyle so as to prevent and recover from health problems. These are some psychological interventions that we can provide, for example like cognitive behavior therapy, behavioral modification, family and couple therapy, biofeedback, rehabilitation, group psychotherapy, psychoanalysis, client-centered therapy, pain management, and etc. Researchers say a substantial number of physical or medical symptoms presented by patients are unexplained medically, which is functional symptoms that respond well to the psychological intervention. Therefore, psychological interventions are effective and cost-effective for the improvement of physical and mental health and the quality of life. So I think that is all from me. I hope that people will look at mental health as a serious issue. Thank you.
Thank you, Dr. Ainu. So, if anyone out there who is currently suffering with mental illness, please do not hesitate to go and make an appointment with the psychologist because it really help you in the future. Now, let's hear the opinion from Dr. Farah. The time is yours, Doctor.
Hello and nice to meet all of you in this forum. First of all, thank you to Ms. Dayani for inviting me to this great forum. It is a great pleasure and honor to share my opinion and knowledge about mental health. To clarify earlier, my opinion will be on my role as a general practitioner doctor at a clinic. Before that, here is to highlight my stand as I think mental health is one of the health problems nowadays. A study shows there is an increased percentage of mental health problems, especially in teenagers and middle age. As a doctor, I witness some of my patients have this problem and sometimes they did not realize it at an early stage until it got worse. Most scenarios, they came to me to ask for a referral letter to the hospital to get further treatment. Mental health illness not just affects their mental condition, but also it does affect their physical well-being as well. They tend to lose focus on what they are doing. They also will lose some significant weight because they lost their appetite. They also might have a history of suicidal thoughts. Most of the time, these problems arise because of lack of support from their surroundings, especially the stigma from their closest circle, especially from the parents. They have been holding on not getting proper treatment until they couldn't take it anymore. We can see there are a few cases in Malaysia relating young age take the action to suicide and to end their suffering due to mental health. Some causes that can lead to mental illness most of the time can arise from unhealthy habits such as not getting enough sleep or eating. Other than that, bad trauma in past history can lead to mental illness. Stucking with negative thoughts all the time can also make our mental health not in a good condition as it will lead to overthinking. Most teenagers that are diagnosed with mental health issues most probably have a history of past bullying during school or stress study issues and pressure from their family. There are also cases within workers dealing with mental health due to burnout in work and few causes that lead to mental health problems. They could not handle the stress of work until it reached the burnout level for someone. Some bosses are so ignorant, not taking care of their employees' well-being and just focus on quality of work until the employee feels burdened and not happy doing work anymore. They are also at the risk of having some chronic illness such as high blood pressure or anxiety due to this problem. Many people still don't have a good exposure and knowledge about mental health and think it's just a small problem. I hope in a few years we can continuously educate people out there about the danger of untreated mental illness and mental health. It is actually one of the health issues that should not be taken lightly by anyone. Thank you.
Thank you, Doctor. All of our panel members today provide useful information and explanation for all of us. Mental illness is a serious matter. We should educate people with all the knowledge that we have to make sure that our society will not have stereotypical views about mental health. From the discussion that we had, we can conclude that mental health is a health issue. So, with that, our forum ends today. I would like to thank all of the panels for attending this forum today, and to all the listeners out there, thank you so much for lending your ears. Have a good day, everyone.
Thank you, everyone.
Thank you.
Thank you.